and welcome to tonight's presentation by Dr. Rob Rutledge, When Someone You Love Has Cancer, What to Say and How Best to Support Them. This talk is the 6th in a series of public lectures called Cancer Answers, hosted by Cancer Care, Nova Scotia. My name is Emmy Luther-Hiltz. I work with Cancer Care, Nova Scotia, and I'm pleased to be your host tonight. While we're here in the Halifax Infirmary, 14 other communities across the province are also participating this evening via telehealth technology. Those sites include Amherst, Antigonish, Bridgewater, Cleveland, Guysborough, Inverness, Kentville, New Glasgow, Sherbrooke, Sydney, Tatamagouche, Truro, Windsor, and Yarmouth. Eastlink Television is also here tonight filming this lecture, and we extend our thanks for their support to this lecture series. Tonight's session will be aired on their Podium TV program. Details will be posted on the Cancer Care Nova Scotia website about airing dates and times. This lecture will also be made available on DVD at your regional library and to those participating sites. You can also access a copy of Dr. Rutledge's presentation on the CCNS website, www.cancercare.ns.ca, along with copies of previous Cancer Answers lectures. In a moment, I will have the privilege of introducing Dr. Rob Rutledge, our speaker this evening. Following his presentation, we will have about 15 minutes for questions. We will take one question from each site, so I would ask that people keep comments brief, and please be reminded to mute your microphone before and after asking a question. So without further delay, Dr. Rutledge is a radiation oncologist at the Nova Scotia Cancer Centre and associate professor in the Faculty of Medicine at Dalhousie University. He specializes in breast, prostate, and pediatric cancers. His research interests center on psychosocial and spiritual oncology, health promotion, and professional caregiver health. A passionate and dynamic public speaker, Rob believes that a positive attitude can impact health and well-being. In 1999, he began a program entitled Skills for Healing Weekend Retreats, a weekend support group program experienced by over 600 cancer patients and family members in 10 cities. Rob has given dozens of academic presentations in 9 cities to over 1,500 healthcare professionals, organized and facilitated 3 day-long workshops for 170 oncology staff, and provided public talks to thousands of Canadians. Rob was presented with the Doctors Nova Scotia Award for Health Promotion in recognition of his contribution to physician health and health promotion in oncology patients. Dr. Rutledge?
Thank you. Thank you very much. It's a real pleasure to be here and to present to a group of people who are so proactive in their health and in their health care, and so supportive in the lives of their loved ones. And I want a special welcome to those in the distant sites, and just realize that many in the audience do have a cancer diagnosis. And from now on, I'd like to refer to those people as the loved ones. And I think it really appropriately so, because I know that the family members here just have so much caring and compassion and really express their love to their loved ones. So welcome everybody. And to those loved ones who have a cancer diagnosis, I think the fact that you're listening to the presentation really sends a powerful message to your body and to your mind about healing and wholeness. And that could be very, very powerful for you. So I really honor you all for listening to the presentation tonight. I'm a bit reluctant in splitting up this presentation and simply presenting it to the family members. And when I say family, I'm talking about the friends, the support system, the relatives, the ones that really care. Because I really feel that we're actually in this together. We learn from each other. And I made that insight suddenly a few years ago when I was in a support group and a young man stood up, and he was sitting there, and he was talking about his journey with cancer, and he'd been through bone marrow transplantation, which is very high-dose chemotherapy, and he was really looking forward to his 30th birthday. That was the goal for him. He wasn't expected to be cured of his cancer, but he really spoke from his heart. And at that moment, I just had this sudden, real feeling of compassion and caring for this character, and it was just as if my heart just swelled up towards him. And in that same moment, there was this kind of shift of blurring. It was as if I could imagine myself sitting in his seat, and he could be sitting in my seat. And I realized right there that life is short and precious. You know, if we live for 3 years or 53 more years, it is short and precious, and that we're on this same boat of life together. And so I'm a little bit reluctant to say, you know, you must do this, I'm the expert, you're going to kind of learn from this, because I think we learn from each other. And sometimes there's these just moments of great acts of kindness and compassion when either the loved one, the person with the cancer diagnosis, or even the family member does this small little act. And sometimes it's to be strong and to show bravery and courage and resolve forward. But sometimes that great act of courage is to ask for help. That's a very great gift that we can give each other, just that asking for help. Sometimes it's to be vulnerable. Sometimes it's to say, I'm having a lousy day today, or to have a tear in your eye, or to have a good cry with your loved one or your family member there. Those are the great feelings of strength as well. So I'm blurring this lecture a little bit on purpose. Now, I am going to provide practical advice for the family members, but realize that advice, especially around the issues of communications and being with those very difficult emotions, really pertain to all of us. I also want to put this in the context that those with a cancer diagnosis really can make a difference in your journey, in your life, and the family members can help facilitate that. And what I'm trying to do is endorse the idea of complete care, and that is conventional medicine and all that it offers with everything else you can do to help yourself. And so when I talk about that, and the science is clear now showing that by empowering yourself with understanding, by getting the best from the conventional medical system, by augmenting that physical care with simple, effective health habits like exercise, good diet, stress reduction, etc., and by adopting a positive and proactive attitude, you can really make a difference, not only in the quality of life, but the science is now showing it influences longevity and survival, and I believe for some even the chance of being cured of their cancer, if that's in the cards for them. So I want to first empower you with that idea, and as well realize that the family member really can help facilitate that process, that complete care package. And just honor those family members that are sitting here tonight. Again, just a wonderful symbol of your love and compassion for your loved one. And again, it's interesting because the science is catching up with what makes sense. When people feel supported, when the person with the cancer feels supported, it actually improves their outcome, improves their stress response, improves their chemistry. And I just went to a conference this last 3 or 4 days ago called Integrating Wellness into Cancer Care. And they quoted a study in which they followed tens of thousands of nurses for decades. And they found that the nurses who felt that they had good support, they actually, at any period in time, they had a 1/3 less chance of dying of any cause and a 50% less chance of dying of breast cancer, simply with an association with support. And the way I look at it is it's the connection between the mind and the body. When you feel supported, it actually has a physical effect in your bloodstream, in the chemistry of your body. So you can go from the stressed state in which the chemicals that are being released actually break down or start to cut into the tissues, to a more relaxed, more peaceful state in which the natural energy of the body is allowing the tissue to heal in a sense. allowing the immune function to work better, better able to fight off cancer cells, better able to recover from treatments. And again, that social support really can make a difference. So I want to honor you folks. I know partly because the family members, as a family member, you can feel quite isolated and quite lonely during your journey. So for instance, think about it. With all your encounters in the medical system, how many times has a healthcare professional looked you in the eye and said, how are you really doing? How are you coping with this? I don't think it happens that often. And I know from personal experience it can be quite lonely as well. About 14 years ago, I was a resident doctor, and my wife, my soon-to-be wife, developed hearing loss and a pain just behind her ear. And she had a CAT scan, MRI scan, and it showed a destructive tumor in the base of her skull. And as, you know, the expert in training, I was numbed. I had a whole mix of emotions, but I was kind of stunned in that moment. And I knew what had to be happen. I knew the pros and cons of the surgery, but there was nothing I could do to fix the problem. I simply had to take it a day at a time. Now, as it turns out, my wife did super well, and 14 years later, she's great. I happened to propose to her on the way out of the anesthetic, you know, on morphine, no positive. I said, "You're going to marry me, aren't you?" You know, I'm trying to maximize my chances. She vomited, but anyways, we won't go there. 5 years after that diagnosis, my wife had a lump in her breast and a biopsy that showed breast cancer. And I tell you, it's no less easy the second time around. And again, you know, as the story goes, things have turned out very, very nicely. But, you know, I think both times around, I would have preferred to have been me. I would have preferred to have been dealing with the diagnosis than to be that family member or friend. So, just want to recognize that it is very distressing to be a family member. And again, the literature is quite clear on this. Oftentimes, the family member has more difficult emotions, more upsets, more stress, more anxiety than the person who actually has the diagnosis. So in one study, 1 in 10 of the family members of women with advanced cancer had severe depression. 1 in 3 had high levels of anxiety, which was higher than the women themselves who had the cancer diagnosis. And the way I look at it is this. The family members often have these feelings of worry and concern, and yet there's no way to kind of place their emotions, no way to help in a sense. And coupled with that, and this is so classic, coupled with that, the family member thinks that they have to put on a brave face. They have to be the strong one. I don't want to burden the person with the cancer diagnosis. So what do? You have all these churning emotions inside of you. You've got this brave face and no way to express it, no way to help in a sense. And I want to, honestly, I'm going to get to some practical advice here, but I want to give you some practical advice, some specific things that you can do there. Now, oftentimes what I'm presenting is a whole smorgasbord of ideas, whole smorgasbord of ways that you can test these ideas, see if they fit into your life, modify them, leave them behind. Because there's no one right way to approach a cancer diagnosis. There's no magic diet, there's no one psychological approach. We're so different that I want you to use what works for you throughout this. And this is actually a very important point as well. Despite this long list of things I'm going to suggest as possibilities, sometimes the best thing that you can do is to simply be there. Just your presence, your willingness to listen, your hope to understand is the therapy, is the place. So there might be a bit of a misnomer what to say, because sometimes you don't have to say it, you have to be there. But listening and understanding gives you the insights that can make you support in the way that works best for you. I like to also use the analogy of working in the same direction, or the analogy of canoeing your boat, your family boat in the same direction. Because sometimes the loved one is paddling one direction and the family member wants to paddle another direction. I want to be optimistic, I want to be realistic. It's that type of thing. I want to do this complementary therapy, no, but I want to do this thing. Not only is it inefficient to be paddling in different directions, it's quite stressful as well. And the other thing that I strongly believe is that the person with the diagnosis, in fact everybody, the person with the diagnosis has within them the insight and inspiration and intuition to know what's right for them. There's this inner wisdom, this inner guide that can help push them forward. And we want to listen to it and honor it. So we need to keep coming back to the loved one with a cancer diagnosis to make sure that we're doing what they want in the circumstance. And different families will do this in different ways. Sometimes the canoe is going to be paddled just by the loved one doing everything, and you as the family member are going to have to sit back and watch and jump in if you need to. But in the meantime, let your loved one do the trick. Other times, the family support system, however you want to say, is going to strap on this huge outdoor motor and just like full throttle that canoe down the river. And that's fine too. But again, the loved one has to be kind of, yes, I agree with this process. And keep coming back, keep listening, because the river of life will keep on changing. There's no doubt about that. Sometimes you'll be in the midst of the rapids and the rocks, and you'll want to negotiate in a certain way. Sometimes many of us will experience long stretches where the river is very calm and smooth. And at that point, we can really sit back and enjoy the wonder of life and the company of our loved one as well. And last point before I get on to the advice is this. If you really, really want to take care of your loved one, be the best support person possible, and I know you do because you're here, it's this. You need to take care of yourself. It's obvious, but we forget about that. Too busy trying to extend. But think about it. If you're burnt out, or if your health is beginning to deteriorate, or you're kind of so stretched that you're getting a little frazzled and cranky, it's hard to be the family member. So take care of yourself. You have permission to take care of yourself. Okay, so the slides here. So I'm going to provide you some practical advice, and we'll talk about some of the emotional issues, because that's the other thing we often don't do. And I may leave you with some taking care of you if we have some time at the end. Ruth Fields drew this picture of her experience of being diagnosed with cancer. What a turmoil. It's like the hurricane has hit. And not only that, people often have to make adjustments and decisions in the medical system as well. Carol Shields wrote of her experience with advanced breast cancer. She wrote, being diagnosed with breast cancer was like waking up on a train traveling in the middle of a stormy night in a foreign land where everybody else speaks a foreign language. And I think that the language he's talking about there is the language of the medical system, the language of cancer and carcinoma and treatment and chemotherapy and so on. So the first point is to understand the language. You can feel so much more in control when you understand what's happening. Being able to watch the plane take off from the control tower as opposed to sitting in the back of the cabin. You're better able, quite literally, this is very, very clear and concrete, you can better deal with problems, you make better decisions, and as a family member, you can help your loved one get better care. It's not as simple as simply showing up for your treatments. You have to understand what's happening there. So how do you get the most from the medical system? Understand what's happening, prepare for your visits with your specialist or family doctor, contact your nurse or doctor, know who to go to if you're having problems or issues, and use it. You must use the system to get the best. There's extra help in the system, so definitely use that help as well. Once you kind of get that information, your physician, your cancer specialist, is going to be the best person to interpret that for you, to individualize it for your particular case. So that's kind of the solid rock amongst it all. But you can empower yourself by talking with somebody. There are patient navigators in many of the regions, and the phone number is there. Go to the experts. The experts in information is the librarian, and almost all hospitals will have a librarian to teach you what you need to know in language that you can understand. The Cancer Society, who sponsored this lecture, also has a cancer information service. Essentially, you can phone them up. They draw on a world-class database and really provide information, not advice, but information and a number of other issues, multiple language. And they can send you either by email or by package, visual package to your doorstep for free, what you've discussed during that initial conversation. And they also are connected with a list of resources nationally and locally there. There are other websites you can go to. So Cancer Care Nova Scotia, for instance, has treatment guidelines on many of the cancers. So you get a breast cancer, you can actually go and see what the standard therapy is, for instance. Canadian Cancer Society also has that same database through their website there. I happen to like this website because it provides easy to understand summaries. But again, each person is individual, and the experts, the librarians, the Cancer Information Service can guide you on that. Getting the most from your visits before, during, and after, so you prepare. Before the visits, create your summary of symptoms, bring the list of medications and your allergies, write down your questions beforehand. Someone needs to go with a person, a loved one there, decide beforehand who's going to write down the record, and you can create a file. I think it's actually very powerful to have your file there so that when the physician says, I don't have your bone scan result from 2 weeks ago, you can say, here it is, take a photocopy and I want this one back. This is quite practical and real world advice. I highly recommend it. You are entitled to a copy of your medical records. During the visit, you have to be open. When the doctor starts talking baffle-gab for whatever reason, you can slow them down. I don't understand. Can you please repeat that in simpler language? Oftentimes, the physicians will chat at the end of the conversation and summarize everything, and that will answer the majority of your questions, and then ask your questions from there. Take notes. You can bring a recorder. And then really, this is the take-home point. Find out what to expect. How bad does that side effect have to be before I do something about it? What do I need to do about it? Who can I call at 3 a.m.? You should have that phone number available to you there. Nurses are invaluable. I think they are the key to the system. After the visit, keep a journal, the side effects, know who to call, I just said. And if need be, if there are multiple people that want to find out what's happening, ask for a family conference so everybody can hear it all at the same time. If you're having problems with your doctor, sometimes you can kind of have somebody who's more the facilitator to do the talking. Keep on calling. The squeaky wheel does get the grease. Ask for information. Ask for another appointment. Ask for a second opinion if need be. You can do that by going back to your family doctor or talking with the nurse. They're actually a great source as well there. The medical system offers a whole bunch of other care. And if you don't ask for it, sometimes you won't get referred. And there are all sorts of other specialists within the system, physio, occupational therapy. Again, ask beforehand. Okay, I just want to talk about the emotional aspects here. Again, a woman, Catherine Burris, drew this picture about kind of her emotional journey with breast cancer. And first of all, most people will just have a freak-out period for 2 weeks, maybe a month after the diagnosis. That's the norm. Whatever you're feeling, it's totally expected. The full range is expected there. And you kind of be, from numbness to actually no emotional. Like some people are completely calm too, and you don't have to be stressed about being completely calm. That's okay. But those emotions can come out suddenly in an exaggerated fashion. You can find yourself crying on a dime or at commercials or whatever else. That is normal. I just want to put it out there. It's normal to be distressed. When your loved one, the person with the cancer diagnosis, starts crying or is super upset or angry, what do we do? What do we do? Listen, just be there. Just absorb it. We don't have to correct the problem. The therapy is really in the listening. Just stick with that. Acknowledge it. Hear them so they know, I can see you're upset. I mean, it's okay to cry. You acknowledge it's okay to be sad or whatever the feeling is there. So only after this, reassure in ways that you can truly deliver. And so, for instance, a very simple way is to say, I'm going to be with you through this no matter what. We don't have to promise miracles. We simply, our presence is the therapy. It's really very, very powerful. So blocks to staying present with those difficult emotions. So we're uncomfortable with these feelings in our life. Yes, it does hurt. It is painful at times to see our loved ones suffer, however that is, physically or emotionally. And we can acknowledge that's difficult in and of ourselves. A lot of people think that if they start crying, they'll never, gain it back again. I'm going to cry for days and days and days. And I've actually seen people on day one consultation have a huge cry, and then I see them the next time, and they look so good. They look refreshed. They feel better because they had the cry. So, if you're there, allow the emotions to come through. Oftentimes, we think that we have to be positive all the time, put on the brave face, and that's the way to go. I think to be real and human really opens the space to have whatever conversation is there. And of course, it can be scary, but to share the fears is actually helpful. And it can be realistic and then positive. You don't have to be negative as well. Okay. So what do you do when you're breaking down, when you're having a bad day, when you're in the midst of tears? Express your emotions. Let it out. I think the brave face, the positive attitude doesn't work well. And there's a real bonding that happens when you can be vulnerable in that day. If you can, tell your loved one. Find the right time. You don't have to burden every day, but find the right time. I really recommend it. And if you can't, for whatever reason, feel that you want to go to your loved one, at least find somebody else. Find a wise person in your life who can be ears for you, who doesn't have to correct the problem. Saying your truth is therapeutic there. But what if it's too much? What if you've gone down and you're spiraling down and you're not getting out of the depression? So if you're feeling super low and blue and hopeless, and if you're unable to enjoy your life, like you're not able to enjoy your grandkids and hanging out with your grandkids, if you're having difficulties making decisions or returning to supposed normal, if you're kind of ruminating constantly around worry and anxiety, or you're not able to talk about cancer and decisions without becoming too upset, then you probably need to see somebody, see a professional. And I really think that's very wise. Just go see a counselor, a psychologist, social worker. Family doctor could be the contact for you. So how do we get help? Tell your doctor or nurse, I'm having a difficult time. They can refer you on to a psychosocial specialist. See your family doctor. And there are other groups, the community-based organizations, the Cancer Society, the other staff can really be very helpful. So it's normal, and we just expect that we're going to go through very difficult times in life. So afterwards, I'm just going to give you the big picture. We're still going to keep getting the best treatment after we're through the actual care, and we can augment that with diet, physical activity, teaching yourself relaxation. You can delve into complementary therapy. I can give you some advice around that one. And use what works for you in past. If you found real connection from your faith-based community, you can go back there, whatever works. Okay, role of nutrition, just very, very quickly individualize it. And if there are real problems with weight loss, nausea, vomiting, treatment of the dietary tract, then get the specialist to help you. Go to the experts. There's a dietitian who is the experts. And then I don't believe in any super diet. I actually think that the magic occurs when you balance out your diet and you have all these interactions between the various food groups. But I offer that to you, especially fruits and vegetables, lower fat. Essentially, you're maintaining a healthy and balanced diet there. Talk to your dietitian. There's another website that you can go to. Exercise, exercise, exercise. If there's one thing to do, I think that's the take-home point. Your loved one needs to listen to their body to guide them, right? I mean, I saw a gentleman recently who is bedbound and a little bit of a sore back. He was stretching his back to relieve his pain. Doing a little bit of exercise can help with the bowel tract, you know what I mean? So little things can make a real difference. And individualize, obviously. If you're on the very well path, then get back to exercising there. Find a way to exercise. Other habits, maintaining a reasonable weight, getting a good night's sleep in the dark has an influence on a chemical called melatonin. Very simple, very practical things to empower your body as much as possible there. Support groups are very powerful. Not only can you get more information, but you're there with people who understand. They can give you good ideas and ways to cope, and a safe way to really express your emotion and really be yourself there. So there's no doubt they improve quality of life. So Cancer Care Nova Scotia knows what's out there, so does the Cancer Society. End of treatment disconnect. This is classic, so classic. The young lady who's been through big-time surgery for breast cancer, 6 months of chemotherapy, 5 weeks of radiation, coming to the end of her therapy. It's just not her, it's everybody. Coming to the end of her therapy, suddenly it's like, how do I get back into my life? A lot of stress right at the end of their therapy. They're suddenly, I'm released back into my home environment. The medical system isn't watching me as much. And so there can be a lot of stress around that time. And the women oftentimes will say, kind of churning, working with their emotions throughout this, whereas the guys are more like, well, I got my treatment done, I'm on with my life here, and we're just on with it. And that's, I don't want to generalize, but that's kind of how it goes. And the disconnect happens if you have one partner who's kind of in one trajectory about wanting to kind of get over it and get on with life, another partner who's still dealing with the emotions and trying to protect other people's emotions and so on. So just realize it takes time, and we're all different, and whatever works for you there. Debbie McLeod, a wonderful nurse psychologist, doctor, talks about the we, you, and I of relationships. And I'll just explain that to you. So the we obviously is the relationship. We have a relationship together. But there's also an I that's outside of that relationship for the family member. And the you is the one who has the cancer diagnosis. And trying to maintain a balance between those three. And there are skews. We kind of get stuck into cancer is the thing that we talk about all the time. It dominates us, and so we forget about the relationship. It's all about I, and we forget about the bigger picture there. And so there are certain myths that go along with this idea that you can't have an I, and you can't have a you, and you can't have a we in this. There's only one story about the cancer experience. If you, as the person who has had cancer, having a certain feeling about what's been going on, then the family member may be seeing something different. And the two stories, the two experiences are both legitimate. The second myth is that sharing emotions and scary thoughts will burden in some way your partner. So you may frighten them or make them angry or overwhelm them in some sense or form. And that creates more disharmony, I think, if we don't share our emotions. The other one that's kind of classic is thinking about your partner and thinking that your partner really ought to know what to do. Like they should be able to figure out what my needs are. And it's a stressful time for them. So if there's another piece of advice, tell them what to do. Tell them what you need. Ask for the help. Very, very clear communication around that point. I'll leave it at that, and I'm going to flash this up just to let you know that you need to take care of yourself in body, listening to your body, and maintaining a weight, and sleeping, and cherishing your body, having some fun, if you can, around all the things, telling someone how you're feeling, keeping it balanced, and having compassion for yourself, and nurturing your spiritual life and those most precious relationships that we have.